Welcome. Today, we delve into the world of hydrotherapy, a practice as ancient as medicine itself, yet continuously validated by modern science. At its core, hydrotherapy is the therapeutic use of water to promote health and treat various conditions. It's a versatile modality that harnesses water's unique physical properties, its temperature, pressure, and buoyancy, to achieve specific physiological outcomes. This isn't just about taking a relaxing bath, it's a targeted clinical approach. The applications are incredibly diverse, ranging from simple localized treatments like hot or cold compresses that can reduce swelling or soothe sore muscles to more complex procedures. We have full-body immersion in specialized tubs where temperature and pressure can be precisely controlled to influence the entire circulatory system. Steam therapy, often used in saunas or as direct inhalation, is invaluable for respiratory health, helping to clear congestion and soothe inflamed airways. Furthermore, we have contrast therapy, the practice of alternating between hot and cold water, which creates a powerful vascular pumping action, flushing out metabolic waste and reducing inflammation. Finally, aquatic exercise leverages the buoyancy of water to provide a low-impact environment for strengthening muscles and improving joint mobility without the stresses of gravity. The overarching goals of all these methods are clear: to manipulate blood flow, alleviate pain, enhance physical movement, and induce a state of deep relaxation, thereby addressing both the physical and psychological aspects of well-being. It is a powerful tool in the arsenal of rehabilitative and preventative medicine. One of the most well-known and effective applications of hydrotherapy is in the management of musculoskeletal disorders. For individuals suffering from chronic conditions like osteoarthritis or rheumatoid arthritis, or those recovering from an injury such as a sprain or surgery, water provides a uniquely supportive environment for healing. Let's break down the science. First, there's the effect of warmth. Applying warm water, typically between 92 to 98 degrees Fahrenheit, causes vasodilation, which is the widening of blood vessels. This increased blood flow delivers more oxygen and essential nutrients to the affected tissues, which helps to accelerate the healing process and reduce muscle stiffness. The warmth also has a direct analgesic or pain-relieving effect on nerve endings. Second, we have the principle of buoyancy. As Archimedes discovered, an object submerged in water is subjected to an upward force. This buoyant force counteracts gravity, effectively reducing a person's body weight by as much as 90%. For someone with painful joints, this is a profound relief. It allows them to move, stretch, and strengthen their muscles in ways that would be impossible or excruciatingly painful on land, thereby improving range of motion and preventing muscle atrophy. Finally, hydrostatic pressure, the pressure exerted by the water on the submerged body, provides gentle, consistent compression around the joints and limbs. This pressure helps to reduce swelling and edema, improves venous return, and can decrease pain signaling, creating a sense of security and support around an injured area. Together, these three properties, warmth, buoyancy, and pressure, create a therapeutic trifecta for musculoskeletal rehabilitation. While its musculoskeletal benefits are renowned, hydrotherapy's impact extends deep into the realms of neurological and circulatory health. For patients with neurological conditions like stroke, Parkinson's disease, or multiple sclerosis, the aquatic environment offers a safe and effective arena for rehabilitation. The water's viscosity provides gentle resistance in all directions of movement, which is crucial for retraining motor patterns and strengthening weakened muscles without the risk of falling. This resistance helps improve proprioception, which is the body's awareness of its position in space. For conditions involving spasticity or muscle tightness, the warmth of the water can significantly reduce muscle tone, allowing for greater freedom of movement and more effective stretching. Patients can work on balance, gait, and coordination with a level of confidence that is often unattainable on land. From a circulatory standpoint, hydrotherapy is particularly effective in managing conditions like edema, which is swelling caused by excess fluid trapped in the body's tissues. The hydrostatic pressure we discussed earlier acts like a full-body compression stocking, helping to push this stagnant fluid from the extremities back towards the core of the body for processing and elimination. This is immensely beneficial for individuals with poor peripheral circulation or those who are post-operative. Contrast therapy, alternating hot and cold immersions, is another powerful tool. The rapid vasodilation and vasoconstriction act as a pump for the circulatory system, improving its efficiency, reducing inflammation, and enhancing overall cardiovascular tone. It's a comprehensive therapy that addresses the fundamental systems that support our entire body. The benefits of hydrotherapy extend beyond muscles and circulation, touching upon nearly every system in the body, creating a truly holistic treatment. In dermatology, for instance, specialized baths known as balneotherapy can be used to treat conditions like psoriasis and eczema. By adding minerals, salts, or medications to the water, these baths can help to reduce inflammation, soothe irritated skin, and soften plaques. The water itself helps to hydrate the skin and gently debride dead skin cells. For the respiratory system, steam therapy is a time-honored remedy. Inhaling warm, moist air helps to thin mucus, open up bronchial passages, and soothe irritated sinus and lung tissues. This can provide significant relief from the congestion associated with colds, bronchitis, or allergies. Perhaps one of the most immediate and profound benefits of hydrotherapy is its effect on our psychological state. Immersion in warm water triggers a response from the parasympathetic nervous system, our body's rest and digest system. This leads to a decrease in heart rate, blood pressure, and the production of stress hormones like cortisol. The sensation of being weightlessly supported in warm water is inherently calming and can be a powerful tool for managing anxiety and stress. This deep state of relaxation not only improves mood but also paves the way for better sleep. A warm bath before bedtime can help lower the body's core temperature after you get out, which signals to the brain that it's time to sleep, leading to faster sleep onset and improved sleep quality. This mind-body connection is a critical component of hydrotherapy's overall therapeutic value.
While hydrotherapy offers a wealth of benefits, it is not universally appropriate. Understanding its contraindications, the situations where it should be avoided, is paramount to ensuring patient safety. We categorize these into absolute and relative contraindications. This slide focuses on the absolute, the hard stops, where proceeding with treatment could be dangerous. First, any acute infection or febrile illness is a major red flag. Applying heat to an infected area can worsen the infection and potentially spread it systemically. A fever indicates the body is already fighting something, and the additional stress of a heat treatment can be overwhelming. Similarly, any active or potential bleeding is a strict contraindication, as the vasodilation caused by heat can increase blood flow and worsen the hemorrhage. Severe, unstable medical conditions are also on this list. For a patient with severe cardiac failure, the immersion in water, especially warm water, can significantly increase the workload on an already compromised heart, potentially leading to a cardiac event. In cases of severe renal failure, the body's ability to manage fluid and electrolyte balance is impaired, and the shifts caused by hydrotherapy can be hazardous. Uncontrolled hypertension is another critical concern. The changes in circulation and pressure can lead to dangerous spikes in blood pressure. Finally, severe skin infections like cellulitis or open weeping wounds must be avoided to prevent worsening the condition and contaminating the water, posing a risk to others. In these scenarios, the potential for harm far outweighs any potential benefit, and a different therapeutic approach must be chosen. Moving on from absolute contraindications, we now consider relative contraindications. These are not outright prohibitions, but rather conditions that demand caution, careful assessment, and often modification of the treatment protocol. It's about weighing the risks and benefits for each individual. Pregnancy is a classic example. While hydrotherapy can be wonderful for easing pregnancy-related aches and pains, care must be taken to avoid overheating, especially during the first trimester, as hypothermia can pose risks to fetal development. This means using lower water temperatures and shorter durations. For individuals with epilepsy, there is a potential risk of a seizure occurring in the water, which could lead to drowning. Therefore, one-on-one supervision is absolutely mandatory, and the triggers for that specific individual's seizures must be considered. In cases of peripheral vascular disease or diabetes, nerve damage may impair a person's ability to sense temperature accurately, increasing the risk of burns. Here, the therapist must meticulously check the water temperature and rely on a thermometer rather than the patient's feedback. Extremes of age also require special consideration. The elderly and the very young have less efficient thermoregulatory systems, making them more susceptible to overheating or chilling. Their treatments should be shorter and use more moderate temperatures. Other conditions like respiratory compromise or post-surgical states also fall into this category, requiring a therapist's expert judgment to adapt the treatment to be both safe and effective. In all these cases, communication with the patient and their wider medical team is key to managing risk and achieving positive outcomes. To harness the full potential of hydrotherapy while mitigating all potential risks, a strict adherence to best practices is non-negotiable. This is where the skill and knowledge of the trained professional become paramount. First and foremost is precise temperature control. Water that is too hot can cause burns, especially in those with compromised sensation, or can place undue stress on the cardiovascular system. Water that is too cold can cause chilling and muscle tension, defeating the purpose of the therapy. Temperatures must be accurately measured with a thermometer and set according to the patient's specific condition and tolerance. Next is the duration of the treatment. A longer session is not always better. Prolonged immersion can lead to dehydration, electrolyte imbalance, or fatigue. A typical therapeutic session might range from 10 to 20 minutes, and this duration must be tailored to the individual's health status. Hygiene is another cornerstone of safe practice. Pools, tubs, and any equipment used must be meticulously cleaned and disinfected to prevent the transmission of infections. Water quality must be regularly tested and maintained. Furthermore, patient monitoring and supervision are essential. A therapist should observe the patient for any signs of dizziness, shortness of breath, or discomfort. Vital signs like heart rate and blood pressure may be monitored before, during, and after the session, especially for at-risk individuals. Finally, hydrotherapy is most effective when it is not a standalone treatment but is integrated into a comprehensive care plan. It should complement other therapies like physical therapy, medication, and lifestyle modifications, all guided by evidence-based principles to ensure a holistic, safe, and risk-managed outcome for the patient. In conclusion, we have seen that hydrotherapy is far more than a simple folk remedy. It is a sophisticated and powerful therapeutic modality with a broad spectrum of applications. We've explored its profound benefits for musculoskeletal conditions, offering pain relief and improved mobility through the unique properties of water. We've seen its value in neurological rehabilitation, providing a safe environment to retrain movement and manage spasticity. We've also touched upon its positive effects on the circulatory, respiratory, dermatological, and even psychological aspects of our health, making it a truly holistic intervention. However, its power must be wielded with wisdom and caution. We have underscored the critical importance of a thorough patient assessment to identify both absolute contraindications, where the treatment is unsafe, and relative contraindications, which require careful modification and supervision. The principles of safe application, meticulous temperature control, appropriate duration, stringent hygiene, and constant professional monitoring are the foundation upon which its success is built. Ultimately, hydrotherapy should be viewed not as a panacea, but a valuable and effective tool within a larger integrated healthcare strategy. When prescribed by knowledgeable professionals and applied with skill and care, it can significantly enhance patient outcomes, improve quality of life, and serve as a testament to the simple yet profound healing power of water. It represents a perfect marriage of ancient wisdom and modern evidence-based medical practice.